Did you know that mumps can affect adults too? And when it does, complications may occur. Mumps is a disease many people think only affects children, with mumps affecting adults as well. One question that often comes up is on the relationship between mumps and infertility. Let's break it down. What mumps is, how it spreads, its complications, its possible link to infertility, and the benefits and risk of the vaccine. Mumps is a viral infection caused by the mumps virus. It spreads through respiratory droplets, saliva, and close contact with an infected person. Yes, close proximity can spread mumps, but the key driver is contact with respiratory droplets or saliva from an infected person. The virus spreads when someone with mumps coughs or sneezes, talks closely with someone, shares cups, utensils, or bottles, kisses or has direct saliva contact, and lastly, touches surfaces and contaminates them with saliva. So it is not simply being near someone in the same room. Transmission usually happens when there is close interaction where droplets or saliva can reach another person. Another important point is that a person with mumps can spread the virus before symptoms appear. People are typically contagious from about 2 days before the swelling starts to about 5 days after the swollen glands appear. The virus mainly affects the salivary glands, the parotid glands, located near the jaw. This is why people with mumps often develop swelling around the cheeks and jawline. Common symptoms include fever, headaches, fatigue, muscle aches, and swollen salivary glands. So although many people recover without problems, mumps can sometimes cause complications such as orchitis. This is a swelling of the testicles. Other complications include orchitis, which is inflammation of the ovaries, meningitis, which is inflammation of the meninges, the brain, pancreatitis, which is inflammation of the pancreas, and hearing loss, though this is very rare. The main fertility concern comes from orchitis. Now, orchitis occurs mostly in males who get mumps after puberty. Research shows that around 20 to 30% of post-pubertal males with mumps may develop orchitis. Symptoms of orchitis may include testicular pain, swelling, and fever. Most cases resolve without long-term fertility problems. However, in rare cases, severe inflammation can affect the testicles and potentially impact sperm production. For women, though, infertility from mumps is extremely rare. The MMR vaccine protects against measles, mumps, and rubella. Vaccination significantly reduces the risk of infection and the complications thereafter. Countries with high vaccination rates have seen dramatic reductions in mumps cases. So vaccination has dramatically reduced disease levels compared with the pre-vaccine era. But mumps has not been eliminated and continues to cause outbreaks worldwide. The current global burden of mumps, however, includes hundreds of thousands of cases annually, periodic outbreaks even in vaccinated populations, complications in about 1 in 10 cases, increasing incidence in some regions including parts of Africa. Most vaccine reactions are mild and temporary. The common side effects may include mild fever, pain at the injection site, and mild rash. A less common effect is temporary joint pain. Rare reactions may include allergic responses, but these occur very infrequently. The risk of complications from the disease itself is generally higher than the risk from the vaccine. In summary, mumps is usually mild, but complications do and can occur. One of such complications is infertility from mumps. Though uncommon, it may occur especially when orchitis develops during a mumps episode after puberty in males. Vaccination remains one of the most effective ways to reduce the spread of mumps and its complication. Understanding health facts helps people make informed decisions because they are health informed. Bangi says, be aware, stay sharp, stay healthy.